Okay, we're back from the break, and right before the break, a viewer posted a question on Facebook, which was who would need and who doesn't need a flu shot. So again, anybody who really wants to get the flu shot can get the flu shot. There are some people that get them every year, and there are some people that basically wouldn't have one. So when I ask a patient, they say they don't get one, their immune system is probably pretty good. Maybe they don't need them. But certainly if you have a chronic disease that could be life-threatening with a flu-like illness, my suggestion is that you do get the flu vaccine. If you're a COPD or if you have a chronic lung condition, a chronic heart condition, those types of things. The other thing to consider is anybody over the age of 75. One of the things that a lot of people don't explain is that your immune system really is not very competent after that age. And you do have to have an intact immune system to be able to process the vaccine and create the antibodies. So there's some question whether or not even those vaccines are very effective in that particular age population. With that being said, if you're in the 60s, sometimes it's better to get a double dose of flu vaccine. And they do make that particular issue. There are quadrivalent, which includes H1N1, influenza A and B, and I think there's another variant of the H1N1 that is included in that. Healthcare workers, it's probably a good idea to get a flu vaccine. You're coming in contact with a lot of people. And certainly you don't want to be a vector for that disease to other people. Again, those people where you travel a lot, that might be a worthwhile issue because you're going to be exposed to that. Along that line, let me talk about something I read that was recently that might be an immune modulator, things that can help boost your immune system even if you were to get sick and you choose not to get a vaccine. It was a combination, and I'll bring it on the show next time. One's called black elderberry. These are common products that you can pick up at any health food store. So I'm going to go through them. It's black elderberry, it's ginger root, it is basically bee pollen, or they call it propolis. Then there is echinacea, and there's activated charcoal, and I think colloidal silver, and vitamin C with rose hips. So that's quite a long list, but according to some of the homeopathic people, this is a preparation that they take anytime they get a sniffle and cold, and they supposedly have not gotten that. The other thing that can help boost your immune system that has been out there is the use of fermented foods. There have been plenty of studies that show people who eat a lot of sauerkraut, or maybe even Koreans who eat a lot of kimchi, which is a spicy sauerkraut, have a lower incidence of influenza and viruses of that type. So yogurts and things of that nature. On the opposite side of that, doing things that slow your immune system make you more susceptible to viral infections. Things like not getting enough sleep, smoking, basically eating GMO process-based foods. All of those things can be detrimental to your immune system and make you more susceptible. So along that line, you can start changing those eating habits, which I've talked about numerous times on this show about eating non-GMO based foods, reducing your carbohydrate intake, reducing that alcohol intake, quitting smoking, doing those harmful things that actually slow your immune system down. So again, one activated charcoal, I think, is 250 milligrams. Colloidal silver comes in 500 parts per million, usually 500 to 2,000. 2 echinacea tablets, 1,000 milligrams of vitamin C with rosehip, 2 ginger capsules, 1 or 2 bee pollen, and 2 elderberry. That combination can be very helpful if you get a cold and flu, in addition to limiting your exposure. Good time to think about N95 masks. They're very plentiful in the hardware stores, things of those natures. Those can be very useful. There was a recent outbreak of a cold even in my office, and all of a sudden I show up there and all my staff's wearing masks, and I'm like, what the heck's going on here? Well, one's sick. So it does help to decrease the spread from yourself if you feel like you're getting a snuffy nose, to maybe put a mask on and reduce your exposure. Again, good hand sanitation. Don't go overboard on that. I've seen too many people select for methicillin-resistant staph by using too much of that hand cleaner. You do need a certain amount of healthy bacteria in your body. And again, if you're taking antibiotics, make sure you're taking probiotics with it, so that your gut stays intact and you're not selecting for resistant organisms. So again, with regard to that flu shot, that's a personal decision. If you have a chronic illness, yes. If you're in the health field, yes. And if you're over the age of 75, I'm not sure the effectiveness. That's why they recommend the shingles vaccine at 55, because if you get it older, it doesn't help you. The pneumovax is one after age 65. Your body just cannot process it, and that's why we see cancers developing later in life, because of our immune system that breaks down in our later years. So with that being said, nobody gets out of this world alive. So one of these slides that I wanted to bring up, again, kind of rehash some of those things we talked about, the survival issue. Again, stock up on life essentials, your medications. Again, 3 to 6 months supply of those particular things. Don't be afraid to ask your healthcare provider to give you a 3-month prescription for generics that you can fill. Pay cash at another pharmacy so that you can pick those items and put them on your shelf. And again, stock up on cleaning supplies. Stock up on chlorine, bleach. It has about a 6-month shelf life. Masks and gloves and gowns. Gloves are very important items you want to keep in case somebody in your family comes down ill and you have an illness. And then I wanted to talk about this thing. I brought it up last time. It's not really related to this, but again, the rule of threes. This is 3 minutes of air. You can't survive without 3 minutes of air. 3 days of water if you didn't have water in 3 days, and 3 weeks of food. So those are very important numbers to keep in mind, especially with the water. And actually 3 gallons per day. I mean, so it's important for you to have the right amount of those supplies, and just stock up, do the things you need to do. Now, as far as what's going on in Pahrump with illnesses, I've seen colds that are surfacing. This is the time of year as the weather starts to change and people start to stay inside a little bit more. Those that have not seen any influenza, pay attention to your local news, pay attention to the World Health Organization about Ebola, be vigilant, be prepared, and make sure that you are trying to keep yourself in good condition, get a little regular exercise, eat right, and stock up a little bit. You know, if nothing ever happens and the food expires, so give it to Goodwill. Give it to somebody who's less fortunate than yourself. And with that, we're basically going to close tonight's show. I hope you enjoy this particular show. We'll try and be back every Monday night with a new topic. And I hope everybody enjoyed the Harvest Festival this past weekend. I know I personally stay away from that just because of the poof dirt that exists in Pahrump. Every time I go down there, I wheeze for a couple of days. It's amazing how it just gets in the air and tramples everything. Somebody said the air is cleaner here in Pahrump, and until you get into one of those things and you realize it's really not. So with that, I will close tonight, and I hope to see you back here next Monday night. Thank you again for Pahrump for tuning in. I'm Dr. Michael Reiner, your host of the Independent Medical Group.